Hello everyone. We see these type of patients very commonly in our ICUs and emergencies. Patient presenting with hypotension. So most likely in this situation we do two things. Either we give fluids or we give vasopressors. The problem with vasopressors is we don't know what to do with them after that. So here are 10 tips which will help you optimize your therapy of vasopressor in critically ill patients. Tip number 1, set a goal. Always have a goal of what should be your target mean arterial pressure or diastolic pressure when you are starting noradrenaline. Tip number 2, always individualize this target. A patient, say a 80-year-old female with 40 kgs body weight, is unlikely to require 65 to 70 millimeters of mercury of mean arterial pressure. In those patients, you can target a low mean arterial pressure. In patients with hypertension, you can have a higher target. So always individualize your goal. Tip number 3, the vasopressors, they induce endogenous fluid bolus. How do they do this? What is the physiology behind the vasopressor inducing a fluid recruitment? Please see this way. Tip number 4, vasopressors can safely be given by a peripheral line. So do not waste time in starting vasopressors and waiting for a central line catheter to be in place before you are starting noradrenaline. You can safely start it in peripheral line and then maybe change over to the central line if the requirement persists. Tip number 5, once you have started vasopressors, always reassess the patient's volume status and the cardiac output. Tip number 6, consider attaching another agent with a different mechanism of action when you are requiring a second line agent. So if you're starting with noradrenaline, it is better to start with vasopressin as a second line rather than adrenaline, which is almost a similar sort of action. Tip number 7, consider adding hydrocortisone in patients with high dose of vasopressors. What is the exact dose of vasopressor? When we say it's high is not clear in literature, but for all practical purposes, you can take it as 0.2 microgram per kg per minute. Tip number 8, vasopressin helps in patients who are having right ventricular failure. It does this because it doesn't have any pulmonary vasoconstriction abilities. Tip number 9, when you see that the vasopressor dose is escalating, you can keep on escalating because there is no maximal doses for vasopressors. However, if you see that the patient is persistently requiring that high dose, then the chances of recovery are definitely less. But for initial resuscitation, you can go as high as you want. Last but not the least, tip number 10, you can give enteral feeding when the patients are on vasopressors. So there is no reason to keep the patient hungry when you are starting on vasopressors. I hope the video was helpful. If you did like our video, then give us a like. Thank you.